Hi everyone, thanks for joining us for our first Instagram Live. I'm Dr. Miret, I'm here with Dr. Brindisi. Today we're talking about migraines, and we're here to answer your questions about them.
Yeah, you want to talk about like what migraine is first, and then kind of what our approach to kind of treatment is?
Sure. Something that we like to explain to patients is migraines go beyond just head pain. So a migraine is an actual neurological event that takes place. This is due to a genetic predisposition to having dysfunction in the brain. And our approach here at CFNC is we want to understand why someone is having this neurological event that is causing their head pain, but also the factors that contribute to it. And so the 4 factors that we first tackle are biomechanical, hormonal, metabolic, and then the neurological components.
Yeah, I think that was great. And I think for a lot of people, there's like been a lot of, up and down over the years about migraine. Is it neurological? Is it vasculature? And we now know that it is neurological, and it's the way that the nervous system, has an issue communicating with the vasculature, and then there's dysfunction there as well. So, yeah. Shall we answer some questions?
Perfect. All right. First question, Dr. Miret. This one just came in. I've started having headaches and I have POTS. Are they connected? You could address that.
Yes. So the answer is yes. And so with POTS being a dysautonomia, the big concern is obviously circulation and fuel delivery around the system. And so a lot of these individuals, because there is a lack of blood flow and fuel around their bodies, they will be more sensitive to pain in general, which is why they experience different types of pain, even that go beyond from the head, but then also why they suffer from a lot of headaches. When we take a step back and look at the neurological component to POTS and dysautonomia, we're looking at our brainstem in the lower areas of the brain, and then in that same area we have our nerves that innervate our head and face as well, so that gives us the perception of head pain, but also this is where migraines do begin. So that's why you often see individuals with dysautonomia suffer from head pain and migraines, but also sometimes migraineurs will have autonomic dysfunction on top of that.
Yeah, and that's a lot of what we see, when we see patients who just have migraine, right? They may or may not have an autonomic disorder, but a lot of times when we evaluate them, we see those systems become, apparent, and they are dysfunctional, but they may or may not meet the criteria for a full-blown autonomic disorder, because like you said, when we look at the brain, we're just trying to understand what areas of the brain are involved and what's contributing to those symptoms. And we see for those 2 disorders, there's a lot of overlap in what we're looking at in dysfunction in the brain. So there's a lot of different areas that might contribute to either one of those. But yeah, collectively there's some similarities in terms of what we find neurologically. And so you can have, I think, we have patients that have migraine, don't have autonomic dysfunction. We have patients that have migraine that do have autonomic dysfunction. We have patients that have POTS that don't have migraine, and we have patients that have POTS that do have migraine.
Yes.
And so it can kind of unfold in, a lot of different ways.
Yep.
Perfect. Dr. Brindisi, can you explain a little bit more about vestibular migraines? We received a question saying that they seem very hard to diagnose. It's hard to find specialists. Can you provide a little more information on that?
Yeah, so with vestibular migraines, they can be tricky to diagnose. It can be tricky for these people to find and get in front of a physician that knows about vestibular migraine, knows how to diagnose them, and kind of knows what they're looking for. For patients with vestibular migraine, a lot of times they can have the vestibular symptoms, more specifically vertigo, where they feel like the room is spinning or they feel like they are spinning, as the aura to the migraine, where they have this vestibular symptom and then they start to develop what everyone kind of thinks of as a migraine, which is the head pain. But a lot of times we see patients that have vestibular migraine or get diagnosed with vestibular migraine, or we diagnose them with vestibular migraine, but they don't have the pain component to it. So those are 2 different scenarios that we can see in patients with vestibular migraine. the thing with vestibular migraine that kind of sets it apart from other, vestibular complaints is that when somebody has true vestibular migraine, we see all of these components that we would see with a traditional or classic migraine still hold true. So like patients will have sensitivity to light and sound and movement a lot of times. These patients may have nausea and vomiting and things like that. Those are kind of classic things that set migraine apart in general from other types of head and face pain, right? We know that those things are pretty classic. And migraine's kind of on a spectrum, right? Like migraine is not just I have this unilateral head pain and I vomit when I get that, right? And it's really, really bad pain. And vestibular migraines are kind of on that spectrum. The other thing that we see with vestibular migraines, I think, is similar to other migraine patients, is they have different triggers. Like we know things like caffeine trigger a lot of migraine patients. We know things like citrus triggers a lot of migraine patients. Red wine, sleep issues, chocolate, like all of that kind of stuff. A lot of times as we dig into these patients that have usually what looks like it's chronic recurring vertigo, right? That's going, undiagnosed in a lot of ways, and people can't pinpoint the issue. So then when we look at these patients, we say, okay, this really looks like vestibular migraine because here's some of the things and the symptoms that they're describing, as well as all the stuff that I just mentioned. Mm-hmm. And then we're looking into, like you said, our approach is, okay, what's going on biomechanically? What's going on neurologically? Are they having a hormonal component to it, right? Are there nutritional things that we need to change? What's the metabolic system look like, and where do we need to go from there? So it is difficult because a lot of times it's a diagnosis of exclusion because it's not really the first thing that people go to as a diagnosis when someone says, hey, I have vertigo or I feel dizzy. So get in front of the right people, I would say. And if you have a functional neurologist that's near you, or even a vestibular PT that's near you, a lot of times they're going to be the ones that are going to be able to really dive in and diagnose that type of condition.
Thank you. Dr. Miret, we've received a couple questions about natural ways to treat migraine at home. And one question just came in asking, is it better to treat with ice or treat with heat? So if you could just provide some details on that.
Yeah. So before I kind of go into that, the importance of getting your migraines treated and addressed, it needs to be individualized. I just want to be clear on that, and addressing, what of those 4 factors are contributing to your migraines, right? Not everyone has all of those contributing factors that are causing their migraines. Some people do, and it's important to first evaluate that. So we'll give some suggestions on, how to address your migraines at home, what we talk to our patients about, but really the important thing to take home is you need individualized care to understand what is going on with your system. Why are you having migraines? Because
something one person may need, somebody else might not need. Yes. Or something that works for one person might not work for the other person. So
yes,
we can give like some generalizations of things that we might recommend for a patient based on what we saw in their evaluation.
Yes.
Yeah.
Yes. So some things that we recommend are ice. Ice on the front and the back of the neck simultaneously. Again, for some individuals, this is fine. Again, for some individuals, this may not work, but this is one of the things that we use to start that approach. Certain supplementation as well can be very useful for helping reduce pain in migraines. Nutritional changes. So again, we talked about addressing the metabolic factors. So nutritional changes and dietary changes that we are suggesting to our patients goes beyond just like the migraine diet. It really goes to their biochemistry and what their system needs. And then there's some obviously biomechanical stuff we can be addressing, as our background is in chiropractic, so we're able to address the biomechanical factors that cause that. And so sometimes for patients they do certain exercises that help reduce their frequency and also their intensity of their migraines as well.
Yeah. Dr. Brindisi, can you go into a little more detail about biomechanics? The question is, if biomechanics are the cause of migraines, does CFNC evaluate and diagnose?
Yeah, so as Dr. Miret said, right, like we look at it, there are these 4 kind of major contributing factors to migraineurs, right? Biomechanics being one of them. You can have restriction in biomechanics. I know we had a question at some point about cervical instability and its role in migraines for other patients, right? So the biomechanics can look very different, across migraineurs and just patients in general, right? As Dr. Miret mentioned, our background is in chiropractic. So if you were to be a CFNC patient, right, we're not only evaluating you neurologically, but we are running you through a full biomechanical assessment, understanding what's going on with the joints, the joint complex, which includes the muscles, the ligaments, the tendons, the nerves, all of that kind of stuff. With migraine, a lot of times we see a lot of upper cervical dysfunction in the neck. We see a lot of upper back, upper thoracic dysfunction as well. And postural things that show up on people's exams. So when you come into CFNC, we're looking at all of that in its entirety. And then, depending on your presentation, right, we may say, hey, you need imaging, right? Or we think there's something more significant going on. So we would refer out for those things. And then we also have the ability to give you an adjustment. We have ability to work on the soft tissue. We have ability to provide you with exercises and things that you may need in order to strengthen, your spine, the musculature around it, and kind of help with these types of conditions. Now, with that being said, not everybody with migraine needs biomechanical work, right? Some may benefit way more than others for biomechanical work, and some of you may be saying hey, I went to the chiropractor and they made my migraines worse, right? That's something that we hear.
Which is actually really important for us to hear. That is a big thing that we ask.
Yes.
Has someone looked at your biomechanics? And I went to X, Y, and Z, and it got worse. That tells us actually a lot about your nervous system function, but also your metabolic threshold. It tells us a lot of information when evaluating you. So, and other functional neurologists too. So if you're in that category, by all means, let them know that.
Yeah, and that doesn't mean that the chiropractor gave you a bad adjustment or that the adjustment wouldn't be helpful for you. But a lot of times the adjustment's really powerful stimulation for the brain. So it may not have been something that worked for you in that moment, but it still may be a big piece to your puzzle, and maybe some other things need to be addressed before you get another adjustment type thing, right? And some of you may say, hey, yeah, sometimes I go to my chiropractor and it helps a ton, right? And then sometimes it doesn't, and I don't really know why. And like Dr. Miret said, a lot of times that's a clue for us, hey, what's going on neurologically? Things don't seem to be as stable as we would like them to be, and so maybe we need to address a couple things first before we say, yeah, go back and see your chiropractor, get that adjustment, and it'll probably help you a lot more than it has in the past.
Mm-hmm. Yeah.
Dr. Miret, we've received a few questions about migraine and your eyes and vision. One question that we received is pressure.
Yeah.
Is it normal to get feel pressure behind your eyes? Another question that just came in, can migraines make your vision, alter your vision? This one person says her vision feels like it's crooked now whenever she gets migraines. Mm-hmm. So what is the connection with your eyes and migraine?
So there's a few things with all those questions. And so one, eye movements are a very large part of our examination process. We do them at bedside, but we also do them under our video nystagmography exam, because there's things we can see at bedside that we can't see on that, and there's things we can see on a video nystagmography exam that we can't see at bedside.
Which is basically a fancy word for a piece of equipment that, we put you in some goggles and it tracks all of your eye movements.
Yep. And so I like to explain to my patients is the eyes are your brain's window out. They're my window in to understand your brain function. And your eyes are in relation to your neck musculature, as an example. They have a lot of connections to that brainstem area. They have a lot of connections to all of that. And so they are actually very pivotal for migraineurs for sometimes treatment options. Obviously, this is individualized for the person, but this is why it's such a large part of our exam. For people having actual visual disturbances with migraines, obviously, it is dependent on is that more of the aura? Is that happening during the migraine? Is that a prodromal event? Is that afterwards? So after the phases of migraine and then you're moving out of them, is your vision still altered? So all of that means different things, and that's why we have to get to the bottom of what is actually happening, when is it taking place, and how long is it lasting. So there is a big connection between migraines, your eyes, and then the visual system.
And I think, like, you know, are those things getting worse over time? Like this particular person's question, right, was she saying, like, I, you know, feel funky when I get the migraine, but now it's like it's lasting longer. Like I don't have the migraine, but my eyes still feel weird, right?
Yep.
Which we see a lot. And that just goes to show that neurological dysfunction that's happening. And I think something to note that maybe a lot of people with migraine maybe do or don't know is that a lot of times the cascade of the dysfunction that's happening neurologically in the brain is happening like days before you ever get that migraine pain, which is why migraineurs sometimes really struggle with understanding, like, what is my trigger, right? And we can speak with in reference to, like, you know, people talk about food, right? Like caffeine and this and that, and people are like, I took caffeine out one time and that helped, and then I took it out another time, it didn't help, it made it worse, or, you know, I went gluten-free for 6 months and you know, it didn't help my migraine, right? Or like I, you know, ate citrus on one day and I got a migraine, then I ate citrus another day and I didn't get a migraine, right? Like that day-to-day stuff, especially with the nutritional things, or, you know, if you're really sensitive to light or movement, that might trigger your migraines, things like that. It's like, it's hard to do like the food diary or the day-to-day diary, because it may not be a one-to-one correlation. It may not be, hey, I ate this thing yesterday, so I got a migraine today, or I ate this thing this morning, so I got a migraine this morning. It could have been something that you did or ate 2 or 3 days ago that actually started that cascade silently in the brain before you ever even noticed the pain. Because what a lot of people also don't know is the pain is like the end of that neurological cascade. Right? Like you have all these things happening in your brain before you ever get that migraine pain, and that's like the end of it, right? But that's the thing that, you know, we feel is the pain. So,
Dr. Brindisi, just adding to that, what does it mean when your migraine switches to a painless one? Is a question that we received.
Yeah. So, you know, when we see these things, so if a patient is going through treatment with us, sometimes we'll see where they start to not have that pain, right? And they may get their aura without having like a full-on, what everyone would consider to be migraine, which is the pain, right? You're still having the migrainous event neurologically, but it is not getting all the way to that end point where you're having the pain. So in our mind, if someone's going through therapy, when that starts to happen, we're like, awesome, that's a great response to what we're doing. We like to see that. For people who maybe have aura without the pain, and that's kind of like how things have always been, right? My question would be, first, are you definitely is it a migrainous event, right? Like that would be my first question for you. And that would be something that we would be evaluating. Like, is this actually migraine, or is there something else going on, right? And if it is actually migraine and you're having the aura without the full-on migraine pain, again, I would say the same rules apply, is that you're not maybe getting that neurological dysfunction to like the end point where it's creating the pain, which is really something that a lot of migraine medications work on, right? They block the CGRP. And so, you know, maybe migraine medicine isn't working for you because your migraine cascade isn't getting to that point. You know, there's a lot of different things that could go into it. But I think, you know, if you were sitting in front of us as a patient, we would be saying, okay, is it truly migraine, right? Or is there something else going on? And if it's truly migraine, I would say, cool, you'd probably do great with neurological rehab, right? Because the migraine event is, you know, a little bit dampened down, even though those auras can be, you know, just as debilitating sometimes as the head pain itself, right? So it's not to say one's better than the other, you know, it's just that we know neurologically kind of where things are, you know, getting to if you have the pain or not.
Yeah.
Dr. Miret, can you provide some information on migraines and headaches and exercise? we received one question saying, exercise tends to trigger migraine. Is any information on that?
I would think a few things with that. When during the what type of exercise would that person be doing? When or how frequent, how intense, all of those things to be in consideration. When is that migraine coming on? So is it actually happening while you're doing the workout? Is it happening 3 days later? Like Dr. Brindisi said, right? The migraines take days to come on. So if you're working out every 2 days, right, and we're in a cycle of migraines happening every 2 to 3 days, and you're noticing that migraine comes on as you're working out, that's a really quick onset for that head pain. So I'm wondering what's happening. But there's also a lot of things that go into exercise, from circulation, blood flow, but also fuel. So are we working out in the morning and we're fasting all night and we're not eating anything? Are we taking a bunch of pre-workout or caffeine before we go work out? Are we skipping lunches, meals? Like, there's a lot of those factors that go in to that before we can kind of get nitty-gritty and specific to why someone would be experiencing their migraine with exercise.
I think that's like a great point, right? To say that answer is not always like so definitive, right? It depends on the person, like you said, right? Like, are they having a fuel delivery issue? Like, is it a metabolic issue? Is it
Biomechanical?
Is it biomechanical? Like, are you lifting wrong? Yeah, that's a great point, right?
There,
So it's like we want to, especially when we are symptomatic, right? We want to have this like definitive answer always, like, why does this cause that?
Yes.
Right? Mm-hmm. But for this person, it may be different for them and why the exercise is triggering their migraine versus, the next person sitting next to them who also has migraine that's triggered by exercise. Those two answers may not be exactly the same. Mm-hmm. And I know that's hard sometimes for people to hear, especially when we're here answering a question about migraine. Mm-hmm. But hopefully that point is getting across. Like, it's so individualized from one person to the next that an evaluation is really where you are going to reap the most benefit of understanding exactly what and why is contributing, to your specific migraine events.
All right, and this will be our last question for this morning, Dr. Brindisi. How do I find a comprehensive practice like CFNC? I have not had much luck finding a doctor in my area that offers a multi-level approach.
Okay, well, I mean, we have a biased opinion, so I would say find a functional neurologist. The website that you can go to is acnb.org. And you can type in your zip code or your address, and you can type in a radius, like 10-mile radius, 50-mile radius, and you can find functional neurologists all over the world who may be, closest to you, and do some research, right? See if that seems like a good fit for you, if that seems like a good doctor, a good practice for you. But that's where I would start when you're looking at, I've been to a lot of people. I can't find somebody that, looks at this stuff comprehensively. I would really challenge you to find a functional neurologist as close as you can. But we see patients from all over the country, all over the world. So we, take patients from everywhere. So if it's something where you're interested in talking more to us, we do offer complimentary consultations and things like that, and we do intensive type programs for patients that travel a distance to come see us. So, whether that's an option for you, I don't know, but it's available. Yeah. And if not, I would say, the acnb.org website is going to be the best place for any of you guys to look and say, hey, where can I find a functional neurologist to treat? And the other thing is maybe integrative medicine docs that have the ability to look at things a little bit more comprehensively, both from a metabolic perspective, but also from like an allopathic perspective, and if it's something that you need more of a medication approach to and stuff like that, I would say them, and then, you know, some of the PTs, especially when we're talking about the vestibular issues or maybe some biomechanical issues. And general chiropractors can help with, you know, nutrition and biomechanical stuff as well. So I think there's a lot of options out there for, you know, different types of providers that can help with, you know, these migraine conditions.
And something that I run into is a lot of people are going to different specialists all at one time, and sometimes they need one person to kind of be that gatekeeper. And so again, like Dr. Brindisi said, we have various amount of approaches for you to be seen by us as well too, like virtual as well as intensive week options. But yeah, see who's around you, and if not, if you need help, let us know.
Yeah.
All right, well, that is all the time we have for today. Dr. Miret, can you share just where this recording will be found?
Thank you for joining us. This will be all over our platform pages, so from Apple Podcasts to our YouTube, our Instagram pages, so there will be a recording of this if you want to like reflect back and see our answers. If you think anyone that you know may benefit from this video, please don't hesitate to share it. If you have any additional questions that you weren't able to make the live and you just have some additional questions, please let us know. This is Migraine Month, so this is what we are talking about all month, so we want to address all of this as much as we can.
Yeah, and if there's any other, you know, topics and things that you guys would be interested in learning more about, and this was helpful for you guys, definitely let us know. You guys are fueling these, so the more information and feedback we have from you, the better. So stay tuned, like, share, comment, save, do all the things. Thanks for joining us.
Thank you.